Is toxic shock syndrome related to tampons? If you've ever used tampons or are considering them as an option for managing your menstrual cycle, you might have heard about a condition called toxic shock syndrome, or TSS. Let's break down what TSS is and how it relates to tampon use. Toxic shock syndrome is a rare but serious illness caused by bacteria that release toxins into the bloodstream. The most common bacteria responsible for TSS are Staphylococcus aureus, Streptococcus pyogenes, and Clostridium sordelii. These bacteria can be found on the skin and in mucous membranes of many healthy people without causing any issues. Now let's talk about the connection to tampons. Nearly half of TSS cases are linked to menstruation, and tampon use is a known risk factor. Here's why. When you use a tampon, it can create an environment that allows these bacteria to grow. The neutral pH of the vagina during menstruation and the oxygen that enters the vagina with tampon insertion can facilitate bacterial growth. Additionally, inserting a tampon can sometimes cause microtears in the vagina, allowing bacteria to enter the bloodstream. The risk is higher if you use tampons with higher absorbencies, like Superplus, or if you leave a tampon in for more than 8 hours. It's also important to note that the peak incidence of menstrual-related TSS occurs on the 4th day of menstruation, and it mostly affects females between the ages of 13 and 19. The symptoms of TSS can start suddenly and include fever, headache, vomiting, diarrhea, and sore muscles. As the illness progresses, you might see a diffuse red skin rash that looks like a sunburn, and you could experience decreased blood pressure, mental status changes, and multi-organ involvement. To prevent TSS, it's crucial to follow some guidelines. Always select the appropriate tampon absorbency for your menstrual flow, follow the package directions for proper insertion, and limit wear time to no more than 8 hours per tampon. Avoid wearing tampons overnight, and consider alternating between tampons and pads. In summary, while tampons themselves do not cause TSS, improper use or prolonged wear can increase the risk of developing this condition. By being aware of the risks and following the proper guidelines, you can use tampons safely and reduce the chance of getting TSS. So yes, there is a connection between tampon use and toxic shock syndrome, but with the right precautions, you can minimize this risk.